Your health is the most important thing you can invest in.
Hey guys, this is Dr. Brenden Cochran from Interactive Health Clinic. Hope you're doing well. What is going on with this political pissing match that's going on and lack of science? And I need to bring this up again because we keep seeing this growing and growing and growing. And I'm hoping enough people finally get this, that medicine has been on this path of financial gain over people wellness gain or health gain for many years, and it's still doing this even in this time of crisis. And there's so much political bantering back and forth about things. So one of the things we saw more recently was, again, calling into question hydroxychloroquine, which, as you've heard me talk about before, we don't really know, and really we need to put it to the test. All the studies that have been done so far have had massive issues with them, where we've dosed the patients in the late stage where they were pretty much going to die, unfortunately, anyways. Let's give them this and make it destined to fail. And we've tried to do that somewhat in studies with natural medicine. As part of the research I was part of with integrative oncology, that was also one of the points was, oh, you're part of an NIH-funded study. Let's punt these people to you that are stage 4, end of life, have done everything else, and see what kind of outcomes you get. And really, when you have a bias on a study like that, and you set it up that way, you really are trying to set up that trial to show something. Hey, it doesn't work. And then you can make a claim that it doesn't work and potentially it could cause harm. And the same thing we're seeing with hydroxychloroquine. Yet, we have people with autoimmune disease that have been on it for years. We give it prophylactically for malaria drugs when people travel and in other countries. And every single statement by every single doctor, and I quote doctor because I do not think these people are doctors. I think they're techs and they're being paid. Every single one of them makes claims that it's harmful and that it causes a lot of deaths. But if you look back at my old videos, we look at some of the other claims and we look at some of the information, and there's literally no research to support these claims of deaths. There are the could cause QT elongation wave, which is basically an arrhythmia in the heart. Could. Not everybody develops that. So this is very concerning when I see science in this bickering match without logic going on, because really what you need to do is put it to the test. Person gets it, you put them on that, and you put them on zinc. That's how it works. You see how it works. Bottom line, it's that easy, and nobody's done that study yet. Nobody's funding that study. It's destined to basically make this drug fail and make it so we're not looking at it. And it's wrong, people. It's wrong. So what else is going on that's kind of fishy in the neighborhood? Well, remember Georgia? They had this great epiphany of, hey, we're reopening. There are no cases. Everything is fine. Well, if you actually read the basically the top 5 counties of Georgia and what their numbers were doing, it looks like this nice line you'll see in this graph that goes from the highest all the way down. And you say, oh, wow, they are doing such a great job. Well, if you actually look a little closer how they manipulated the statistics to make it look that way, all of a sudden you go from April 28th to April 27th. We went backwards. April 29th, May 1st. Where the heck did we jumped? Oh, April 30th. Okay, we jumped ahead again. Then we got May 6th. How the heck did we jump all the way to May 6th? May 4th, May 5th, April 25th. Why did we go back there, huh? May 2nd, May 7th. Wow, April 26th, May 3rd, and May 8th, and then May 9th. Wait a minute. Doesn't that look weird to you? Yeah. Statistics are manipulated here to make it look like, hey, there are less people being infected, instead of this oscillating curve of actually it's plateaued and the same amount of people are doing that, right? And we're still having a problem getting this contained. So That's really concerning when they put all the dates, align them specifically so they can make you think, and then the news channels jump on this and say, well, there's no problem there. Yet you see that a day ago, hey, the uh, Georgia's coronavirus data from the governor, basically data was made up or looked safe, was a lie. So they caught him red-handed lying about this to make it look like they were doing such a great job. Of course, everybody's lying, right? Everybody's trying to get the economy back up, not piss people off, not follow science, but follow their own tasks or whatever it is. And you see this crap going on all over the place. And again, we're not showing people facts. So we're really dividing the country up by political battles, which is totally garbage. And there's no science anymore. I mean, literally, science is out the window. It's really concerning how what you would think some top people who have some degrees from Yale and stuff, there's no science. They just have their heads clear up their ass or buried in money. And pardon my language, but it really frustrates me when we get rid of science and put money and politics in front of science, right? It just harms people. So we go further into this, then we see, hey, some of these reopenings. There was a cluster outbreak at a rural Arkansas church gathering, similar to what we saw in Calgary and some of the other church gatherings where a small group of people tried to get back, a lot of singing, a lot of contagious, and guess what? A good portion of who was there actually got the infection. So that's also very concerning. But hey, we had good news, right? We have this thing come out a few days ago that said vaccine experts say, hey, Moderna, you rock. You've got this vaccine that looks like it's going to work. We're going right from phase 1 to phase 2, phase 3, fast track this thing. We're going to even talk about manufacturing. Well, a few fishy things when you look at this. One, the CEO of Moderna really likes to sell stocks if you ever look into him, and he's selling them like crazy. And really, when you sell stuff a lot of your company, Moderna, that should be concerning that maybe you don't have it right. You're just trying to dump stuff off to get out or cash in and make this thing look bigger than it really is. So that's kind of a conflict of interest to see that come up. The other thing that really was concerning is there's a massive part of safety that was missed in this. I know we're in an emergency and we're trying to get something going, but this massive area of safety was just skipped. We went straight to humans, skipped all the animal trials, skipped most of the toxicity trials. We skipped it all, just went through a small human trial for safety and said, well, looks like so far those 40-something people are fine. And they might have mounted antibodies. And then let's rush this to phase 2, phase 3, and we're already ready for manufacturing. Well, what does that do? What it does really is it shoots stocks up, and then people buy and they say, oh, we got the cure and we're going to make a bunch of money. It basically makes the company more money. That's what it does. And we're putting people's lives and people's safety in jeopardy. So when I see that, you guarantee I'm not going to be the one volunteering for that thing because safety is going to have to be proving out so we don't have other side effects developing out of that thing, especially when you're skipping a large portion of safety studies that has to be done. All right, so safety studies weren't done. This thing's being rushed along. We don't even know if it works yet. Why do I mean that? Well, we said it mounts antibodies, which is a good finding. However, guess what? There was another vaccine trial called the Oxford vaccine trial that was very, very promising if you looked a couple weeks ago or even a month ago at working, and because it mounted antibodies as well, and that was great. Unfortunately, they gave it to them. They tested it in animals and monkeys. They gave this to the monkeys, and the monkeys mounted antibody response. And guess what? Then they infected the monkey, and they said, "Here's your coronavirus." And unfortunately, it did not work. Ooh, there's a big boom for a company that was already getting ahead of itself for manufacturing and pushing this out. That yes, we had antibodies. However, it did not work for this specific virus. So that's the thing that can happen. I know we want to get excited about these things, but the magic bullet takes time. Normal vaccine development safely can take up to 10 years to develop safely, and we have not developed yet one for RNA viruses that works effectively. So my concern is rushing and causing safety concerns for patients is my concern. My other concern is we should be investing in studies to put this hydroxychloroquine thing to rest. Is it good? Is it bad? Test it with zinc, because that's how we know how it works. Put science first before we put money first, right? And the whole thing that's going on right now is really, really, really concerning. And my hope is that enough people use logic through this, and we start to move forward and kind of maybe fire a bunch of these people who are in government positions who are just totally screwing this up, because it's really, really bad. All right, what else are we going to talk about today? Proactive health tips. Now, after I went into the what's going on in the news, what's right, what's wrong type of talk. So a few other things I want to talk about with natural killer cells. Briefly hit these before. Natural killer cells, astragalus. Astragalus is one of the top prescribed botanicals in traditional Chinese medicine. We use it in our clinic as well. Astragalus is kind of like its Latin name is Radix astragali. It has numerous published studies, clinical trials, significant efficacy in prevention and treatment. And in SARS-CoV-2, astragalus is the most common traditional Chinese remedy in formulas for prevention of this in China currently that's being used. Astragalus is known to actually increase natural killer cell activity. And also there is some research looking at astragalus and some of its extracts increasing telomere length, which happens to increase the likelihood of your age or your lifespan is what telomere length does. What else do we have for NK cells? Andrographis. Andrographis, actually, we talked about in a very early video at protecting the lungs. And andrographis has actually a few human randomized control trials being used in upper respiratory tract infections and being helpful in upper respiratory tract infections. It also does a great job of promoting natural killer cell activity and reducing any inflammatory reactivity, inflammatory storm going on. And then we have Ganoderma. Ganoderma is a mushroom. It is called reishi mushroom. It's also used in traditional Chinese medicine, and it has a lot of antiviral properties. It's been studied in dengue fever, HIV, HPV, enterovirus, and the herpes virus, and it does an especially well job at activating NK cells and T helper cells, and it downregulates a lot of the inflammation in the lungs. So reishi is an awesome mushroom if you're looking for it specifically to work on viruses, is another one as well. And so most of the mushroom extracts actually do this. So what we use clinically for NK cells a lot is we kind of alternate between these. And the reason I say alternate between these, because some of you may be running out and grabbing, astragalus or grabbing reishi or grabbing coriolus, or maybe even doing a blend of mushrooms together. And what I found clinically, and this is what we do when we treat patients with chronic illness or chronic infections, is if you rotate an agent, then the virus and your immune system, it keeps things guessing. So you can keep your immune system primed if you do, say, a couple months of astragalus and then you rotate to a different agent, and then a couple months of that, and then you rotate to a different agent. By doing that rotation, it keeps your immune system guessing. And it also, if you have an infectious bug that's more chronic, it makes it so it's less likely that you have a resistance to that bug that we see so often in medications. So anything you're taking, we talk about the core, and if you haven't downloaded the document on Interactive Health Clinic of our core supplements, those are things we take ongoing, but right now. But the other things like, again, reishi or andrographis or astragalus or any of these herbs, or echinacea, for example, we typically want to rotate those around, not just keep pounding at the same one during this. That keeps your immune system guessing. All right, guys, hope you like this video. Please share it. Hey, hit the like button. And if you want me to talk about anything, please do tell me, because I'm just digging right now. If you want me to talk about any health topics, I'm happy to talk about that. All right. Have a great Wednesday.
This is another really good incentive to invest in your health. Investing in your health is the best thing you could ever invest in.